Hello everyone, my name is Barbara Wingord and I will be doing a presentation on viral hepatitis A, B, and C. Hepatitis can simply be described as the inflammation of the liver. There is multiple different types of hepatitis. Viral hepatitis is caused by a virus, such as in hepatitis A, B, C, and D. Alcoholic hepatitis is caused by heavy alcohol use. Toxic hepatitis is caused by poisons, chemicals, medicines, or supplements that are toxic to the liver. Autoimmune hepatitis is the body's immune system attacking the liver. Hepatitis A is caused by hepatitis A virus. It is part of the Picornaviridae family and the hepatovirus genus. It is stable in low pH levels and in frozen to moderate temperatures. High temperatures above 185 degrees Fahrenheit inactivate the virus, as well as formalin and chlorine. It is endemic in places where sanitation measures aren't the best, where clean food and water aren't always found, and immunizations aren't easily accessible, such as in South and Central America, Africa, Asia, and the Middle East. Hepatitis A is transmitted through the fecal-oral route, usually from ingesting food and water that were contaminated with the hepatitis A virus. This disease attacks the liver, causing inflammation and damage to the cells. The hepatitis A virus is excreted in bile and comes out of the body through stool. Hepatitis A has an incubation period of 14 to 28 days, but can last up to 50 days. You are most infectious 2 weeks prior to symptom onset and no longer infectious a week after jaundice onset. Elevated liver enzymes are common, such as alanine aminotransferase, or ALT, and aspartate aminotransferase, or AST. These resolve and go back to normal within 1 to 6 weeks. Other symptoms are nausea and vomiting, jaundice, right upper quadrant pain, fatigue, anorexia, fever, pale stools, and dark urine. Some testing that can be done to find hepatitis A is hepatitis A specific immunoglobulin. Immunoglobulin M, anti-hepatitis A, is found 5 to 10 days prior to symptom onsets and shows an acute infection. Immunoglobulin G, anti-hepatitis A, shows antibodies in the blood that remain forever even after acute infection. Some treatments are inactivated hepatitis A vaccine for healthy individuals 1 to 40 years old. Immunoglobulin therapy, or the transfer of antibodies in gamma-stan through an intramuscular injection, is recommended for people who are immunocompromised or have chronic liver disease. There's a couple of vaccines that have been found and proven to prevent hepatitis A. The first one, found in 1995, is the Hepatitis, and the second one, found in 1996, is the Vacta. These are both 2-dose vaccinations. The Twinrix, found in 2001, is a combination vaccine that also helps prevent against hepatitis B. This is a 3-dose vaccination. Prognosis of hepatitis A: once you are treated from the acute virus, you should have long-term immunity. Rates decline about 95.5% since vaccines were initiated and education on prevention was initiated. Hepatitis B is caused by the hepatitis B virus. This is a double-stranded DNA virus that replicates in the liver through reverse transcription. It is part of the Hepatitis family with 9 subtypes and 10 genotypes, which are classified as A through J. Genotypes vary geographically. As an example, genotype F is endemic to Alaska. This specific genotype is associated with the risk of hepatocellular carcinoma. Hepatitis B is transmissible through parenteral or mucosal exposure of hepatitis B positive body fluids. The virus can survive on surfaces with no visible fluids for up to 7 days. There is an incubation period of 2 to 3 months, which can range from 1 to 6 months on certain cases. It is spreadable during the acute infection while there is a high viral count. 2/3 of all infected with hepatitis B are asymptomatic. Now, the 1/3 that are symptomatic experience fatigue, nausea, jaundice, elevated liver enzymes such as AST and ALT, pale stools, and dark urine. There's a couple tests that can be done to find hepatitis B. Hepatitis B DNA serum show an active infection. This can be present up to 21 days prior to the hepatitis B surface antigens. Hepatitis B surface antigens show an inactive infection, mainly chronic hepatitis B. Treatment is mainly based on the symptoms. Unless you're immunocompromised, have chronic hepatitis B flare-ups, or are a high-risk patient, then antivirals are introduced. There are a handful of vaccinations that are approved to prevent hepatitis B, some from pediatric patients to adults to the Twinrix that is both hepatitis A and hepatitis B preventative. Vaccines are up to 80 to 100% effective, and they help with all genotypes. Most fully recover from hepatitis B. There is a small percent of people who do develop hepatitis B chronically. The prognosis of 5 years is up to a 50% survival rate. Hepatitis C is caused by the hepatitis C virus. This is an enveloped RNA virus that attaches to hepatocyte receptors in the liver. It is family of the Flaviviridae, and the genus is Hepativirus. It has 6 major genotypes and up to 80 plus subtypes. Hepatitis C is transmissible with contact of an infected person, such as in sharing needles or syringes, tattoo or piercings with needles that weren't properly cleaned, blood transfusion or organ transplants prior to 1992, birth to an infected mother, or sexual contact with an infected person. There is an incubation period of up to 8 weeks. 80% of people infected with hepatitis C are asymptomatic. The rest have almost identical to hepatitis A and B symptoms, including jaundice, right upper quadrant pain, fatigue, anorexia, fever, pale stools, and dark urine. Gold standard testing for hepatitis C is the hepatitis C RNA. This shows the viral load, the genotype, and the predicted response to interferon treatment. This is very important with choosing what medication to use or for how long. If HCV RNA is present for longer than 6 months, this shows a chronic infection. Immunoglobulin M shows an active or a recent infection, when immunoglobulin G can show a recent or active infection or a past infection. This is why we would rather the hepatitis C RNA. It's more specific. Some treatments. Most people are asymptomatic when they are acute, so it can't really be treated, or they don't know that they have it. With chronic, we usually do a combo of pegylated interferon and ribavirin. It's a 24 to 48 week process. There is new drugs that were found, the direct acting antiviral drugs, or DAAs. This is an 8 to 12 week with a high cure rate, but it is very expensive and very hard to get doctors to approve it or prescribe it. Due to the vast number of genotypes and subtypes, we do not have an immunization yet, but there is over a 95% cure rate, with 5% of chronically infected possibly requiring liver and transplantation. Possible complications of all 3 are prolonged cholestasis, acute renal failure, autoimmune hepatitis, liver cirrhosis, hepatocellular carcinoma, fulfillment hepatitis in almost 1%, chronic hepatitis requiring liver transplantation.